Welcome back to AI in Medical Affairs, Road to 2030. I'm John Lawrence from MphaR Cambridge, and with me, as always, is Natalia, VP Head of Medical Affairs at MphaR, joining from Switzerland. Natalia, great to be back.
Thank you, John. And I have to say today's topic is my favorite because it touches something that is changing right now in the field and the real visits and the real conversation between MSLs and key opinion leaders. And I think we are still learning what that change means to us.
The title of this episode is The Smartest Person in the Room, and I want to start there because that phrase used to describe something very specific about the MSL role, didn't it?
It did. For a long time, when MSL walked into the key opinion leaders meeting, they were the most prepared person in the room. They had learned the science, reviewed the publications, understood the company data, and come ready to share that perspective with the clinical experts. The key opinion leader was the practitioner, the researcher, but the MSL was the one who had done the preparation. That was the dynamic.
And that's changing.
It's changing quickly because key opinion leaders today have access to the same AI tools that MSLs do, and many of them are actively using them. The assumption that an MSL automatically holds an information advantage when they walk into the meeting no longer holds. And if companies and MSLs don't respond to that, the value of the entire medical field interaction might be at risk.
So today we're going to look at three things: how MSLs were actually trained and directed until recently, what a key opinion leader would honestly expect from an MSL visit in today's world, and what AI makes possible in terms of preparation, prompting, and verification. Natalia, let's get into it. Let's start with how the traditional model actually worked. And I want to be honest about this because I think there's a tendency to gloss over it.
Yes, and I want to be clear that is not a criticism of MSLs or medical directors. This is how the system was designed, and it was fit for its time. MSL were trained by their companies once or twice a year. Annual training events sometimes biannual. Scientific updates were delivered, key messages were refreshed, and the MSL went back into the field with that knowledge until the next cycle. So the knowledge was periodic, not continuous.
And the direction of each visit, that came from above.
Entirely. The medical directors defined the narratives, the key messages, scientific focus, which topic to prioritize, what not to discuss. MSL job was to execute that direction consistently and compliantly with the right key opinion leaders, which makes complete sense from regulatory and consistency standpoint. But it does not mean that MSL had limited autonomy in how they frame a scientific conversation.
And what did they bring into the meeting itself?
Approved materials mostly, slide deck prepared by Medical Affairs, product monographs, selected publications that had been reviewed and approved. Personalization was minimal by design. Preparation for specific opinion leader usually means checking the CRM notes from previous visits and scanning whatever publications were available if there was time before the visit. That was the reality for the majority of MSLs.
So the MSL was well prepared in a general sense, but not necessarily prepared for the specific key opinion leader with their current thinking in this specific moment in their research.
That's exactly the right way to put it. And now, here is the question we have to ask, and it is uncomfortable. In today's world, where key opinion leaders have access to AI, where they can pull the information, a literature review, and scan summary in 15 minutes, what would they actually expect from MSLs who request time with them?
That's what we put directly on the slide.
They do. Does the MSL know what I published last month? Can they add something I don't really already know? Are they here to inform me or to listen or think with me? Do they understand the real-world gap between the trial data and my patients? These are the questions running through a key opinion leader's mind, consciously or not. When they're deciding whether a meeting with an MSL is a good use of their time. And if the honest answer to most of them is no, the interaction has limited value. Key opinion leaders know that, and they will make themselves less available for the next one.
That is a direct challenge to the traditional model.
It is, and the industry needs to take it seriously rather than assume that the relationship built over the years will absorb it indefinitely. Relationships matter, but they don't compensate for ever the interaction that don't add value.
So let's make this concrete. Side by side, what did MSL preparation look like before AI, and what does it look like now?
Before AI, MSL preparation was shaped almost entirely by the company provided, training once or twice a year, medical director defining the narrative and the messages, approved slide deck and materials, CRM notes from the last visit, and publication scan if time allowed, but rarely specifically focus on what this particular key opinion leader had been working on. That was the toolkit.
And now?
Now, MSL with the right AI tools and critically the skills to use them can walk into the same meeting with something fundamentally different. A full picture of everything that key opinion leader has published recently, including preprints and Congress abstracts that might not even be widely circulated yet. AI synthesized summary of the key opinion leaders' known scientific position, what they have argued for, what they have questions, how their thinking has evolved, an understanding of the gaps between what the key opinion leaders cares about and what the current evidence addresses, anticipation of the specific questions and objections this person is likely to raise based on their own published work, and scientific narrative that is personalized, built around the expert actual interest, not a generic deck adapted in the last minute.
That is a completely different level of preparation.
Yeah, and here's what makes this significant. A key opinion leader who is engaged and well-informed themselves will notice immediately which type of MSLs they are talking to. Generic preparation is now visible in a way it simply wasn't before. And when key opinion leader notice, it damaged trust. It signals that the MSL didn't think the visit was worth real efforts.
So the standard has risen across the board.
The minimum has risen. What used to be considered thorough, impressive preparation is now just entry requirements. And companies that are still training MSLs for the old minimum are setting them up to underperform in the field.
So if the standard has risen, training has to change. Where do companies need to start?
I would say 4 fundamental shifts. First, from periodic to continuous. Annual or biannual training events need to give the way to ongoing. AI curated scientific intelligence. MSL should be receiving a regular digest, weekly ideally, of development of relevant to the specific therapeutic area and the individual key opinion leader portfolio. Not a lot of information, but curated relevant feed that keeps them up to date between formal training cycles. The science doesn't pause between training events, and neither should the MSL's knowledge.
That's a real structural change in how companies think about MSL development.
It is. Second, from message delivery to dialogue skills. MSL of the future is not primarily a messenger. They're a scientific discussion partner. Training needs to be developed the skill of asking the right question, of facilitating of exchange, of being comfortable sitting with the uncertainty and saying that's really a good point. Let me come back to you on that. Not presenting the right slide, facilitating the right conversation.
Third shift?
From generic call plan to specific key opinion leaders preparation, MSLs need to learn and companies need to train and expect the skills of building a personalized scientific brief before every significant visit. Not a template with the key opinion leader's name filled in. A specific picture of this person's scientific world right now, what they're working on, what they're questioning, and what they care about clinically. And fourth, from company narrative to scientific judgment. MSLs must develop the confidence to engage critically with the science, including their own company's data, acknowledging limitation, engaging honestly with the competing study. Key opinion leaders respect that kind of intellectual honesty far more than well-rehearsed key message.
Let's get specific about the preparation itself, because I think the prompting piece is where a lot of MSLs and companies are still figuring out what good looks like. Can you walk us through what a strong AI prompt for key opinion leader preparation actually looks like?
This is one of the most practical things we can share, because the quality of what AI gives you is entirely determined by the quality of what you will ask. A big prompt sounds like this: tell me about Professor X. What you will get is a general overview, maybe biography, list of publication, nothing that helps you to walk into the meeting as a credible scientific partner.
And a strong prompt?
A strong prompt sounds like this: summarize Professor X's last 5 publications in oncology, give me key findings, their stated position on immunotherapy sequencing, any public comments on treatment-free survival as an endpoint, and scientific questions or gaps they have highlighted in their own work. That prompt gives you something more useful. In under 5 minutes, literally 5 minutes, you will know this key opinion leader's current scientific focus, their publicly stated position, the question they're asking in their own research, their Congress activity, and the area where they're likely to challenge or probe you. This is preparation that would take hours before, if that possible at all.
But the output has to be verified. You can't walk in on the basis of an AI brief you haven't checked.
That's for sure. 5 rules for verification. First, always trace the source. Every factual claim AI makes about key opinion leaders must be traceable to an actual document, a publication, a recorded comment, a Congress abstract. If AI cannot cite the source, treat the information as unverified and don't use it in the meeting. Second, check publication dates directly. AI training data has a cutoff. For key opinion leader preparations, always verify the most recent publication on PubMed or institutional profile. So don't rely on AI for recency.
And the other three?
Third, ask AI to flag its own uncertainty. Build it into the prompt itself. Add flag any statements where you are uncertain or where your information may be outdated. A well-prompted AI will tell you where to verify. And fourth, confirm key position with one primary source. If AI gives you a summary of key opinion leader's stance on a particular topic, find one document that confirms it before you sit in the meeting. One verification step prevents a significant credibility risk. And fifth, trust your scientific training above all. You're an expert in the room. If AI-generated claim feels inconsistent with what you know from your own knowledge of the science, question it. Your scientific judgment is the final verification layer, not the algorithm.
And that last point is so important. Over-reliance on AI without verification is its own risk.
A serious one. An MSL who walks into the meeting overconfident on AI-generated brief and gets challenged by key opinion leader on a factual error, that's a credibility problem that will take a very long time to repair. AI is a preparation tool. It's not substitute for scientific thinking.
Let's name the risk directly. What happens to companies and MSLs that don't adapt?
Three things. First, key opinion leaders disengage. Their time is limited. When a visit doesn't add value, when it feels generic, underprepared, or like repeat of what key opinion leaders already knows, they will not prioritize the next one. The access that MSL have built over the years can erode faster than people realize. Second, trust erode. When MSL cannot match the depth of key opinion leader who spent 30 minutes with AI before the meeting, credibility suffers. And in a function that runs entirely on the relationship and scientific credibility, this is fundamental. Third, and the biggest strategic risk, the MSL role gets repositioned. If medical team becomes associated with the information delivery rather than scientific partnership, companies will start to question their investment. This is the conversation no medical affairs leaders wants to be having.
And for the MSLs who do adapt, what specifically do they do differently?
I would say five things. They use AI to prepare, not to present. The preparation happens before the room. In the room, they are fully present, listening, thinking, engaging, not mentally running through the AI brief. They know key opinion leader's scientific footprint, and they let that show in the conversation, not by reciting it, but by asking the questions that demonstrate they have done the work. They write precise prompts and verify the output before every significant visit. And that is a professional standard now, not an optional extra. They focus on insight, not information. AI can generate the data. Only a trained scientific professional can generate meaning. The most valuable thing an MSL can bring is a perspective. Synthesis, honest question, a challenge, not a data point that key opinion leader could have found themselves. And they follow up with precision, a curated, specific, timely follow-up, relevant publication with one paragraph synthesis or why it matters to this key opinion leader specific work. It's worth more than any standard response document.
Natalia, as we close, what is the core message for the MSLs listening to this?
MSLs who use AI well does not become less human in the conversation. They become more present because they have done the cognitive work before they walk in the room. AI handles the information gathering. MSLs brings the scientific judgment, the relationship intelligence, the ability to read what is really being asked. Those things cannot be automated, but they can be significantly amplified by an MSL who prepares well. Their role is not under threat. This is a turning point, and MSLs and the companies who recognize that now and act according to that, they will define what excellent MSL will look like in 2030.
Natalia, that is an important message, and I think it will land with a lot of people listening to you. Thank you.
Thank you, John. And to anyone who is listening and who is MSL, please do not hear us as a criticism. Hear an invitation. The tool exists. Opportunity is real. The question is whether you and your organization will move first.
And that is episode 2 of AI Medical Affairs Road to 2030. If this conversation was useful, please subscribe to the MphaR YouTube channel. New episodes twice a month. And if you want to think through what AI transformation in the medical field could look like for your team specifically, visit m-phar.com. That's m-phar.com. See you in the next episode.